Welcome to our EASD coverage. Dr. Martin Schön from the DDZ in Düsseldorf was honored on the EASD 2025 with the Rising Star Award. In the following, he will summarize the key points of his presentation to the topic Exploring Diabetes Heterogeneity.
Thank you very much for the opportunity to introduce myself and our work that we have done in German Diabetes-Center in Düsseldorf in Germany. So my presentation or our work that we do in Düsseldorf is mostly focusing on improving the precision of diabetes diagnosis, because now we have two big groups, apart from other types of diabetes, type 1 and type 2, but there is a lot of heterogeneity among or within these two groups, which means that people with diabetes have different levels of insulin secretion, even within type 1 or type 2 diabetes, and also the same with insulin sensitivity. And the current guidelines don't really suggest how can we target the treatment, and also how can we screen for complications that are related to diabetes. So there have been a lot of studies and a lot of focus also all around the world on this topic. And in our work, we applied algorithm that was initially developed in Scotland, in the Great Britain. They initially developed this algorithm on 23,000 individuals with newly diagnosed diabetes from the health register, and they developed like a continuous representation of the diabetes heterogeneity. We applied it on the very well phenotyped German diabetes study cohort. That is a multi-centric study in Germany in many centers, but this is the leading center that aims to explore the natural course of diabetes. And we found that using 9 variables that are very cheap, quick, and measure in the clinical settings, we can actually define the phenotype of diabetes when it comes to different levels of insulin secretion or insulin sensitivity, and that further relates to risk of certain complications that are typical for diabetes. For example, cardiovascular risk, neuropathy, but also depression, for example, or diabetic foot syndrome, and so on. And we believe that this research could pave the way, like tailored, so individualized treatment options for people with diabetes for the future. So in other words, we would be able to identify what's the metabolic phenotype of each person with diabetes, and then to advise the treatment, the best treatment that would be that the person would benefit the most for the future, to lower the risk of complications and to improve the glycemic control. And maybe for the future, what studies we have already started actually to work with this topic to improve the precision prevention of diabetes diagnosis. For example, when it comes to also lifestyle recommendations. So we would like to be able not only to say the person with diabetes from what kind of treatment he would benefit the most, but also from what kind of exercise or diet in the future. And another multicentric study in the German Diabetes Network is the study that aims to focus on intermittent fasting diet, especially in high-risk subtypes of diabetes that have the highest risk of complications. So that we believe that will be the future, and this research could contribute to this topic and to tailor, to individualize management of people with diabetes.
And do you have some surprising results so far?
We see, and I think that's becoming quite a hot topic in the research. Also, like on the morning session of the president at the Congress opening, we heard that there's a lot of people that are classified as type 2 diabetes but have no autoantibodies. And the presenter presented that also it's in the case with type 1 diabetes in certain countries, for example in Africa. I think those data suggested even like 65% of people diagnosed, classified as type 1 diabetes, which is recognized as autoimmune diabetes, do not have any diabetes-related antibodies. We see in our cohort and also in some other countries across the world that it's also the case for both type 1 and type 2 diabetes. And we just don't really know about the pathophysiology, why the insulin secretion is so low in those people, because they don't have any autoimmunity. So we don't really know the pathophysiological basis. And in our cohort, in our work, we saw surprisingly that this phenotype relates to relatively high blood pressure, which might seem unrelated, but also some other studies or other approaches help to improve Precision diabetes diagnosis suggested that if you have very low insulin secretion without any diabetes-related autoantibodies, you might have increased risk for arterial hypertension over the course of the disease, and actually very early after diabetes diagnosis. So that's something that I would not expect, and that surprised me, and we would like to research it more. And also it could maybe help us to understand the pathophysiological background of this type of diabetes.
Thank you for your time and have a nice conference.